So welcome to today's version of our George Blue Spruce Hero Healer Series Luncheon. We're honored today to have Dr. Ron Yee with us to share. This series is about putting in front of us individuals whose character we can emulate. This is really deeper learning, where we figure out who we're going to be, we project what we're going to be, we think about how we can be better individuals and better at serving mankind. Dr. Yee is a physician, son of an osteopathic physician. He practiced for 20 years in the Central Valley of California at a migrant community health center working with farm worker populations. He was born and raised in that area. But over the last year and a half, he has become the medical director for the nation's safety net of community health centers, the National Association of Community Health Centers. This safety net is the largest provider in America. They are in every state and territory of the U.S. Kaiser's next in 8 states. They will take care of 23 million people this year. Kaiser will take care of about 8.5 million people. In many ways, and we can measure it in a variety of ways, they are the best provider in America. If we want to look at the sick care side, there's a lot of numbers to show that they provide the best care in America. But we really ought to look at the health side, because where there's a community health center is the only place in America where America is actually getting healthier. Where a community health center opens, hospital costs go down 25%. Ron is now the medical director for this national association. It represents 1,300 now community health centers operating 9,500 clinics across the U.S., taking care of 23 million individuals. Let's welcome Ron Yee.
Thank you for joining me today. Again, I'm Ron Yee and have the privilege of spending a little time with you. I was in your seat, gosh, how many years was it? I graduated from medical school in 1990. So what I'd like to do today is spend a little time with you to talk about my journey. Not all rosy and standard journey of going from high school to college to medical school to residency. I mixed it up a little bit, did things a little bit different, had some snags. So hopefully you can communicate and connect with kind of a different way. Some of you may be those scholars that went straight through and did everything perfect and had the great scores, MCAT scores or DAT scores, and got in, but a little bit different on my story. What I'm entitling this as the breaking and making of a healer become leader. And what I want to do is just share with you very candidly some things that has happened in my life and steps that I've gone through, kind of a roundabout way into medicine. But I think these different steps really built me as a person, my character as a healer, as a physician, but also as a father and a spouse. I think it really had a big impact on me. So I want to walk you through kind of my early years coming out of high school and everything. I was one of those people, you think you can do everything. If you're at the top of the class, you think you can do all the sports, academics, other activities, keep up with your grades and everything. Well, I got to college, it was a little bit different. And I'll tell you a little bit about that story. I'll walk you through that, how I kind of went through some humbling times, which I think was really good. But then I went through some rebuilding times where I regained my confidence in who I was, how I was put into leadership positions, and then grew from there. On to just coming on the national scene, how I got involved in leadership on the national level and where I ended up where I am today. As Gary mentioned, about a year and a half ago, I moved to Bethesda from California to take a job with the National Association. And finally, I want to spend a little time with you, and I think probably the most valuable thing that you'll hear today is the lessons I learned from my patients. I have some cases that I want to share with you, and things that really my patients taught me. And in many ways, they're the real heroes out there in the field that have endured hardship, disappointment, loss. They're the ones that I've learned a lot from. So I want to share just a few cases with you and some of the things I learned from them and with them. So like I said, came out of high school thinking I owned the world, I could do anything. So I ended up going to UC Davis, which is only about an hour and a half where I grew up in the Central Valley of California. As Gary mentioned, my father was a doctor of osteopathy, one of those country docs. He had one of those huge bags that weighed about 40 pounds. And he would do house calls, delivering babies. He had IV in there, IV materials. He had suture kits, the whole thing. So I grew up getting to see that. And he never really pushed me into medicine, but there was something about it that really caught me, that I almost felt really basically a calling to do that. So I went to UC Davis and had a rude awakening. Coming from a high school of 212 students, I went to UC Davis, and my OChem class was 500 people in this massive auditorium. They graded on a curve, and pretty soon I didn't find myself up there on the cream of the crop anymore. So that was really challenging. It was very humbling to go through that. I thought I could do everything like I did in high school, so I went out for intercollegiate baseball, made the team. My grades went down, my batting average went down. It was not good, not a good scene. So then I had to make a decision. After I got my first C in my spring of my freshman year in my chemistry class, I thought, man, am I cut out for this? So I had to really sit down and think about it hard. But then I came back to, you know what? I really do feel like this is something I want to do. I want to have an impact on people's lives. I want to make a difference in this world. So I kept at it. I pushed on. I decided no more baseball. That was a wise choice. So I got through, and in the end, my grades were okay. I wasn't a stellar student. My MCATs, again, were kind of medium, not stellar. And so I applied to medical school. Got a bunch of rejections. Some of you may have experienced that. Some of you may have just applied to a few schools and gotten into all of them. But my course was very humbling for me. Coming from a family of a physician, my brother is also a physician, thinking that I wanted to follow in the family footsteps. And so that was a rude awakening for me, to go to the university to find out that I really wasn't as hot as I thought I was, that I wasn't as desirable as I thought I was, being rejected. So, always being the planner, I had a backup plan. So I thought, you know what? If I don't get into medical school in the States, I'm going to go someplace else. So, ended up in the Manila, Philippines. So I went to school at the University of the East in Quezon City, Manila. So that was an interesting experience going over there. They do teach in English. They use all US books, so that was a good thing. But one of my good friends, who was also in the same course as myself, we were good friends through college. His dad was a neurosurgeon, so he was headed towards medicine as well. So we both applied and had our kind of safety valve for the Philippines. So Dan and I went over to the Philippines and started medical school. And I didn't know it, but he was actually on the waiting list at a US medical school. So after 2 weeks of getting there, going through all this visa stuff and getting luggage over there, it was just a hassle going through customs and all that. This is when Marcos was in power there, so some really unrest in the country. Anyway, we went over there, got started. 2 weeks later, he gets a phone call. Dan, you're into school at Oral Roberts University Medical School. So he looks at me and says, Ron, we had all these plans to be over here to do outreach work, to learn and have a different culture and learn about the language. And he says, I can't go. And I said, Dan, you have to go. You have an opportunity to go to school in a U.S. medical school and to go to any country you want later on when you're licensed. So anyway, Dan left after 2 weeks, and that was a really tough transition for me. I didn't know anyone there. I had massive studies, as you all know, especially with your first semester, just inundated with work. And on top of that, I had started a relationship with, she wasn't my fiance yet, but my girlfriend. That was really tough, being 3,000 miles away. And back then, we did not have cell phones, Skype, or FaceTime. So we had the standard phone. And I made one phone call. For 10 minutes, it cost me $50. That was a lot years ago. So we soon decided we're not making many phone calls. So we went to letter writing. So that's part of the story too, which I will develop as we go along. So anyway, that all happened in Manila, Philippines. Well, my friend went back to Oral Roberts University School of Medicine, where I ended up going, and he told me about the school. And ORU is very similar to ATSU in that we really learned about whole person, holistic medicine, body, mind, and spirit. And he told me all these stories about what he was learning about caring for people, how they had this one class called cross-pollination where they would do case studies where they had seminary students, law students, business students, nursing students, medical students, and dental students all in the same class. And they broke up into groups and did case studies and said, what'd you think about this? You know, this person was uninsured and unemployed, and yet they ended up in the emergency room in a hospital, and they walked out of there with $300,000 in debt. What do? So the business people came in and started saying, well, you know, let's work on this. Maybe they can find a loan or some grant or something. The seminary students came in and said, these are the spiritual aspects we need to think about. We had some psychology people as well, I forgot to mention. They would come in and say, you know, there's going to be depression here, anxiety. So we took these cases apart. Anyway, my friend was writing me letters and telling me about this. I was going, man, that is just really neat. So what I decided to do after my first year was apply to Oral Roberts University. So as you all know, there's a program out there called Early Decision. So I had come to the point where I felt, okay, I'm either going to get into ORU because that's really where I want to go to school, or I'm going to stay in the Philippines and possibly practice the rest of my life in the Philippines, if that be God's will or whatever. So I applied and just thought, okay, went back to work, started studying again. Pretty soon, a few months later, I got this phone call. Hey, we want to interview you. I was like blown away. I really got an interview. So I flew back from the Philippines, went to my interview. One quick story about the interview, and I'll follow up on that later too, is the biochemistry teacher interviewed me. And so he looked at all my records and everything. And so at the end of the interview, he gets up to the whiteboard and he draws, for you OChem people, he draws a picture of an alkene and then an alkane, and there's an arrow going between. And he said, hey Ron, tell me about the reagents you would use to get from here to here. I was like, what? You know, this was like years ago that I had taken biochemistry, or OChem actually. And so I just felt really bad. You know how you go to an interview, you want to answer every question perfectly, you want to be right on. So anyway, he goes through the interview and everything, and then at the end he goes, anything you want to say at the end of the interview? So I thought about it and I thought, wow, should I say something? Should I just suck it up and take it? You know? I thought, okay, I'm going to step out a little bit. So I said, Dr. Jones, I feel really bad, you know, being a pre-med student, interviewing for medical school. You know, I came in here, I want to answer every question correctly. I want to basically impress you because I want you to choose me to be a medical student here. So he said, okay, no explanation, and I walked out. So months later, I get a phone call from my mother. Ron, you actually got in. You got into Oral Roberts University Medical School. I was like, I couldn't believe it. So packed up things, went back, ended up getting married right before medical school. So if you want to add some of those stress points when you add up your total score, I had all of them. I moved, medical school, got married, did all that stuff at one time. So got into ORU. And I'll tell you later on when I went to school, I talked to Dr. Jones. So on my first day of class, in his class, I said, Dr. Jones, what's with that interview? I felt totally awful when I walked out of there. He basically destroyed me. I didn't think I was coming to school here. He goes, Ron, I wasn't interested in you telling me, you know, it was potassium permanganate or the reagent. I wanted to see how you responded. He said, I knew you weren't going to answer that question, but I wanted to see how you handled the pressure and how you would answer and respond. And so I thought, whoa. So that really kind of blew me away, but helped me feel a little bit better. So took my little detour to the Philippines, but came back. So ORU, medical school there. You can see my wavy hair I had back then. ORU was really great because, as I said, very holistic approach like ATSU, body, mind, and spirit. Learned some great things. Our professors were awesome. We had a class of 48, so very small. So we had very personalized teaching. The only problem with that is the school had some major financial problems because the classes were so small too, and they had a large faculty. So I actually was in the last class of Oral Roberts University Medical School. So there were 9 classes. I was the last one when I graduated in 1990. So sad to say, but it was an excellent experience. I loved everything I learned there. The approach, the philosophy on care, I think was really important, which you all are getting here. So I want to encourage you to really take in everything that you have. So, as you all know, there's a struggle to getting through medical school, but I did survive. So I got through with a lot of help with friends, study groups, talking to professors, staying after class, going in on the weekends to do anatomy, got through it and graduated. So that was a very happy day for me to really get through. And to be totally candid, I was about in the middle of the class, or maybe a little low on the lower side. So that's where I'm coming from. So I got humbled a couple times and through medical school as well. I wasn't acing the classes like I did before. I had a little more trouble in college, but I got through. So I'm thankful for that. So where did I go from there? Then I started looking at residency, and I knew because of my background and my experience, I wanted to go into primary care. So I looked for residency programs and did a lot of my rotations, emergency room, I did internal medicine, a lot of programs that I was interested in. So I found one in Fresno. So I ended up at Fresno, UC San Francisco in the Fresno campus doing family practice. That was a really great experience. I learned a lot, and again, I had grace shown to me because my confidence was rebuilt once again. So by vote of our peers, I became the chief resident. So I got to do some leadership things, got to go to a few more conferences. Of course, I didn't like making up the call schedule. That wasn't too fun because I always got the bad call when no one else wanted it. I took it. But I learned a lot. And so that was the beginning of kind of my leadership pathway and my journey. So ORU, then to the Philippines, then to residency program in California. So that was a very special time. That's when we had 2 children. So my internship year, I had a child, and then my 3rd year, and then 2 years after that. So my kids are all 2 years apart, and that was really just exciting and a great time for us. Well, after that, I found out about this thing called the Community Health Center. Going through residency, I had no clue what that was, never heard of a community health center, nothing about it. So one of my residency mates and I both heard about this job, and so we both interviewed at the same time and both started the same day, right out of our residency. So we finished, we took our boards, and then we started working at Community Health Center in Fresno County of California, where we took care of migrant farm workers and their families. And so it was a really great practice. I got to do a lot of OB, along with that pediatrics. This was kind of the olden days. We had much better facilities after that. Got involved in the clinical leadership there, so I became the associate medical director just 2 weeks after I started, because the then medical director wanted some help. So we both wanted to maintain our practices, so we split it. So I was the assistant medical director, he was the medical director. So that occurred for quite some time. As I got more and more involved, we had training there. So these are UC Irvine students that come through a group called Prime LC. So that's the students that have exposure to primary care in rural communities. And these are also combined MD, MPH, or MBA students. So they have a 5-year program. And so they would rotate through, and we'd get to do some teaching and exposure to that. I also got involved more and more in the medical leadership at our health center, and actually decided I needed to get a business degree so I could understand how things work together. So I went back to school while I was working, taking call, working on Saturdays. I fit in an MBA and learned a lot about the business. So I really enjoyed that. We also got to have some exposure to local congressmen. This is Congressman Costa, Senator Costa, who's from California in our district. He stopped by there. So it was a very rich and enjoyable practice. Got to deliver babies, do all the fun things I wanted to do, and learned about leadership and administration. So over time, while that all happened, I began getting involved more and more, first on a state level, and a lot of this was just showing up to meetings and them saying, hey Ron, what do you think about this? How should this work? Does this work on the front lines? And I would just say, yeah, I think this works, or this doesn't work. And they would sometimes go, wow, that's really amazing. I was like, this is the way we practice. So anyway, I got more and more involved. Before I knew it, I started attending the National Association meetings in Washington, D.C., and then they rotate the other one, the Community Health Institute, around the country. So I started going to those with my CEO and learning more and more about community health centers. Well, before I knew it, I was on some of the committees, the Clinical Practice Committee and a few others, and they asked me the same questions. Does this work on the front lines? How should we handle this? And I would just give feedback, and they'd say, that's really great, unique ideas, innovative. And I was like, this is just what we do. So before I knew it, I was elected to be on the board, and then because I had an MBA, they actually elected me to be on the executive team as the treasurer. So I kind of worked my way up there over a few years and got involved that way. Before I knew it, they said, hey, do you want to act as a consultant for us? We need some help on workforce. So I spent a year kind of splitting my time between the health center, continuing my practice, hospital call and all that, and then doing some work for them on workforce. Really enjoyed that a lot. But then my CEO said, you know what, Ron, we need you here 100% of the time. We have a lot to do. We have a lot of transitions, so we'll probably have to put that away. So I continued working on the executive team and being involved with NAC, but I really refocused my time on my practice and the health center administration. So over time, I did get involved with a lot of things. I got to meet with some neat people. We had Secretary Sebelius here. This is one of the senators. They had me give him an award. This is the National Health Service Corps. I got to be on the advisory council there. But I do want to challenge you, going through residency and even your training now, try to keep your focus, keep your life balanced, which I'm going to spend a slide on later on, while you're going through all these things. So yes, you need to study hard, you need to focus, but don't lose sight of why you're doing it. So while I was doing all that, we had multiple trips down to Mexico. So we were in California, so we could drive down to Mexico and be there in like 7 hours. And so I took my kids, my family, went with other groups, and we continued going down to Mexico, where we would go to orphanages, we would go to battered women's shelters, really keep the vision. Even though I was seeing underserved population every day, I kind of liked the little extra. So it kind of sharpened me a little bit, and my colleagues, we would go down there for a week at a time. So that was really special. What I want to challenge you with too is this: I have my family right here, my in-laws, and my kids, and my wife. Keep them, your significant other, whatever, at the center of what you do while you're going through. Because when you finish later on and you don't do that, you're going to regret it. So please take the time to spend with your family. I tried to study whenever I could when my wife was in the apartment when I was in medical school. But my kids growing up, I was probably at 95 to 30%, 95 to 100, almost 100% of their events at school, sports, and everything. I made time to do that. When I took call, what I would do is I would tell my colleagues, we had a decent call group, if it's during waking hours and my kids are awake and I'm not on call, I would have you cover me. If my kids are sleeping, I will go out and do the delivery because I wanted to be there for my patients. So what I did was, even though I had an active obstetrics practice, I was able to keep that balance of being there with the family, but also being there when my kids were awake. When they were sleeping, I went out, I'd stay up all night, I'd come home, take a shower, say good morning in the morning, and go to work. So that's the way it works sometimes. But that seemed to work really well and help me keep focused. So over time, I rose up in the leadership, and as Gary said, I came to work for the National Association about 1.5 years ago. It's just been wonderful to be able to have an impact on a national level. And I think all these things that happened to me in the past that seemed negative, I think were really important in building my character, in one sense really humbling me, which I needed. But what it did was it really affected the way I treated nurses when I was in the hospital. It affected the way I treated my medical assistants. And I think it really made me more compassionate and patient. And so I think I needed to go through this process to really have the breaking part, but then the rebuilding. And so that gives me a different approach when I work on projects, when things get a little intense. I can hang on a little bit longer. I don't get as angry as quick, and I think I have more patience. So I can see where traveling overseas had a big effect on me. You all have the privilege to go to school at a U.S. High-quality medical school. I was willing to go overseas, and that really helped me to appreciate my education in the States that much more. So that built into who I was. It helped me to really build my relationship with my then-to-be wife. Having a long-distance relationship was really challenging, and when I took this job, we were actually apart for 8 months, and I could see how that 1.5 years apart, even though we weren't married yet, really helped us in those 8 months that we were apart while she was taking care of my in-laws and my kids until my daughter graduated from high school. Then she came and joined me. So when you look back, you can look in retrospect and see how all these little aspects and parts of the puzzle fit together, but it's all for your good. So don't get overstressed when you're going through challenging times. Take a step back and think, what can I learn from this? And know that in the future, it will be used for your betterment. So I just want to challenge you on that and stick it out, whether it's school, a relationship, a job situation. I encourage you to stick it out, go the extra mile before you make any changes or drop out of something or give up. So that's kind of my journey of how I got to where I am right now. I think I want to spend time really talking about the people that had a huge impact on my life, my patients. And people ask me, do I miss practice? I haven't practiced in 1.5 years. I don't miss the medicine part, but I miss the relationships. So my relationships with my patients, and I'll tell you about a few of them That's what I really missed, my patients and also the staff. I had medical assistants that I worked with for 12 years that knew exactly how to set the room up and all that. But more than that, they treated it as their practice as well. So I want to encourage you and challenge you, when you get out in the field and you start seeing patients, include other members of the team. And it may look totally different when you get out than the standard way we practice, but include people in that team, create that team. These are their patients. These are not just your patients. These are the team's patients to take care of. This is our responsibility. These are our family, really, that we take care of. So I want to encourage you on that. So a few points about some of my patients. So Cynthia. Cynthia is one of my favorite patients, but one of my most difficult patients. So she's about 62 right now. I followed her for 20 years. So she was one of my very first patients when I came to the health center. Cynthia has a very interesting disease. Any of you pathology people, anybody hear of Marie-Charcot tooth disease? No pathology people here? Okay. Anyway, it's perineal nerve dystrophy. So basically her calves and her legs are basically atrophying. And so she has major pain all the time. It's kind of like a form of muscular dystrophy. Anyway, she has had this diagnosis, and Cynthia's been challenging because she has all kinds of psychosocial issues going on. She's on pain medications. She needs it. I've tried to get her to pain specialists. We're out in the rural area, so I had nobody to send her to. So I ended up managing her on my own. So I went through the whole standard thing of, we had a contract of, I understand you have bona fide pain. We will treat you because it's real. But we have some rules and regulations and guidelines how we do it. She stuck to it for 20 years. Amazing. So she did. So she would come in and tell me, hey, doctor, you know what? I think I need to let you know I'm using marijuana for my pain. And she said, I know you don't have a license to do it, but I just want to let you know. So we had that kind of relationship that was very honest. And I would tell her, look, Cynthia, you're pushing it a little bit. You used your medication up. You're asking for refill. We can't do it. You need to spread it out. So what I learned through Cynthia was the balance of firmness but gentleness, which I call tough love. In that, you're going to have some patients that are very challenging. I know when she comes in, it's 45 minutes. So she's not one of those quick 5-minute visits. And I prepare my MAs knew Cynthia's coming in, so they would make sure things were set up. If I was in there more than 45 minutes, they kind of pop their head in and say, hey, how you doing? We need to get going. But my staff worked with me, and we took very good care of Cynthia, and she bonded with us. She would bring in fruits for the staff. She would stop by to say hello, and actually after 2 months after I came here, she actually tracked me down and called me on my phone in my office and said, Dr. Yee, I miss you. How are you doing? So those kind of relationships you will have. You'll have patients that are very, very challenging medically, socially. She had major depression as well, and other liver problems. A lot of medical problems besides her dystrophy, muscular dystrophy. But those are the ones that a lot of times you will really bond with because you go through hard times with them. She had breakups with her husband multiple times. She had death in the family, and I was there. In those 45 minutes, we would talk about all kinds of things, and she'd come with the whole list every time. So I encourage you, take the extra time, figure out how to work your schedule to really learn from your patients and be there for them. So tough love, I think, is a big thing and a balance you need to find. Second of all, Graciela. I don't know if you recall back in 2010, but there was a big outbreak of pertussis, or whooping cough. Started in California. And actually, the very first case, infant that died was one of my patients. The very first one. So Graciela was a great patient. It was her first pregnancy. Farm worker. She worked in the fields. She and her husband both worked in the fields. Very poor family. They wanted to get pregnant really, really bad. So finally ended up getting pregnant. I followed her, delivered her baby. Did great at the beginning. So I did his 2-week check, and I thought we were, doing good. So then I find out later on, about 3 weeks later, and I had no contact with him when this all happened, but he ended up in the emergency room with a cough, fever, respiratory distress, and actually died. He had pertussis. They tried to treat him, but they were too late, so he died. That was really tragic. I went to the funeral, was there for them. The husband is the one that really felt bad. He was carrying this guilt. He had a cough, and he felt like he's the one that made his son die. So this was really tragic. And so I finally had them come in and I said, I would ask her, how's your husband doing? He's like awful, he's depressed. He feels responsible. So I called them both in. I needed to use a translator because my Spanish is not perfect, but I wanted to make sure they understood what I was saying. The wife was pretty good, but I wanted to make sure the husband. So we sat down and really talked it through, and I found out that he was never tested. He had a mild cough, and there was an outbreak in another area of town. And so I told him, there is no way to know if you did this. And I said, from your symptoms and what you're telling me, I doubt. And I would not put that on yourself without having a test result or something. And so we met a couple times. It took us a while to really work through this. But in the end, they kind of worked through it, and he accepted that and felt like, what, maybe I wasn't responsible. So a year later, the good end of the story was a year later, they came back pregnant. So I got to follow him for that and deliver the baby, and so we got to kind of close that loop. But had he not been released from that guilt, I think he would have just continued on in depression. They probably wouldn't have had their children. Their lives would have been damaged and possibly destroyed. So take the time and go a little bit deeper with your patients. If you have situations like that, be sensitive to the things outside of the straight medical things and go a little bit deeper to be there for your patients and to release them. If they're tied up in guilt or other things, be there for them. The next one I want to talk about is this place that I've worked for 23 years. It's called Hume Lake Christian Camps. It's up in the Sierra Nevada mountains of California. Beautiful place. This is actually the dock that they have boats. There's about 2,000 kids every week for 10 weeks in the summer that go to camp there. And I was the camp physician for 23 years. I would donate 1 week out of the summer every year, and I would take care of kids. They would have cuts, scrapes, fish hooks in their fingers. Then they also had some really severe injuries. I had fractures. I had put people in neck braces on backboards. We had concussions, major lacerations. And one case that was the toughest one I had that I'll share with you. If you look at this picture here, there's like a building here. This is a dining commons. So right in front of that, there's a little bench sitting there that overlooks the lake. So I want to tell you a little bit about Katie. So I was the physician there for that week. We carry pagers, and we're basically on call 24 hours a day. So they put you up at the camp. You get to eat free, and my wife didn't have to clean anything, so it was great. So I'm going through my regular week, and then I get a page at 1 o'clock in the morning. So I pick it up, and it's voice. We didn't have digital or anything like that. Voice, Dr. E, please come to the infirmary. So I get my clothes on, and I walk down to the infirmary, and they have the ambulance there. There's like 4 nurses there, a bunch of people there from security, and they have a patient there, a young girl. So I found the head nurse. I said, hey, what's going on here? They said, wow, we got this camper, senior in high school, has never had a seizure in her life, had a seizure, fell off her top bunk, and is basically unresponsive. So I thought, okay. Family physician, I didn't do a lot of emergency medicine, so I'm thinking back, okay, what's going on here? What do I need to rule out? How do I work through this? Did a quick exam on her. She was still seizing when I got there. So I thought, okay, standard treatment, a little Valium, we'll see if we can calm it down. Gave her a very, very small dose. So I got the nurse everything. We gave her a small dose. She stops breathing. So I'm like, okay, man, what did I do? Did I give the wrong dose? What's going on here? What's my differential? Am I missing something? So then we ended up having to needed bag and mask on her. So we got that in, got the tube in, started bagging her. Still unresponsive. Her pupils were fixed and dilated at that time already. So we called down the hill. We had a helicopter come up and meet us. We were it's an hour and a half drive to Fresno, which is the next major trauma center. They actually flew up that night. We had to drive partway down the hill because the trees are so thick they can't get in there directly. So we had to drive part down the hill. Here I am, bag and mask the whole way. Just going all kinds of things going through my head. What did I miss? What did I do? Did I do something wrong? You ask yourself those questions. So we get down the hill, we transfer her into the helicopter. I'm still doing the bag and mask. And so they now have monitors on her. And I was so into it, they go, you need to slow down. I was pumping really fast. She goes, slow down, we're okay. So then we got down the hill, and this was the place where I trained. So I knew a lot of the people in the emergency room already. So they said, "Hey, Ron, what happened?" I said, "You guys, this is a healthy teenager, fell off her bunk. We don't know if it's because she fell off or what happened." So they took her into the back, the trauma room, started working on her. Probably about an hour later, I was sitting out there waiting. They came out and they said, "You know what? Nothing you could have done." She had a rupture of one of her cerebral arteries in her brain, and basically one hemisphere of her brain was filled with blood. And so she basically had a stroke. They did a lot of different tests, basically had no brain waves, was basically brain dead at that point. So this is a tough one of being there. You know, our first feeling is, as a clinician, you almost feel like getting out of here, getting out of there, like, you know, I didn't have anything to do with this, I don't want to get blamed. But I kind of came to my senses really quick, and I thought, really, what's important here? So I made that call to her parents. Her parents were in Southern California, about a 6-hour drive away. Got a hold of them and told them what had happened. I told them the initial diagnosis, and they said they would be there as soon as possible. So I actually met them at the airport. I picked them up from the airport. I took them to the hospital. That was really tough. I mean, just calling them was tough. Got them to the hospital, and they basically spent a very short time by the bedside, and I was there with them, and they talked to the specialist, the trauma room doc, and basically said, you know, she doesn't have anything left. And they decided to turn her ventilator off. So I sat there with them and cried with them. It was tough. But I learned a lot about being there for my patients in those tough times. Even when I didn't even know her. I never knew her. But I bonded with her family. I was there to help them. It taught me a lot about compassion. And the thing that was really interesting was word got out really quickly in the camp. And as I said, there's about 2,000 kids there every week. Kids got really serious about life. They had some discussions that were life-changing for them. Some of them, this was their friend who was in their high school. She was the homecoming queen. She was an athlete. She was a scholar. Very promising future. And kids sat down and really started asking some of those questions. You know, what's my life about? What am I doing here? Where am I going? So good things came of that. Her name was Katie, and she was 20 days short of her 18th birthday. But I learned so much from her, even though I never knew her. I learned about compassion. Some people say you don't cross that line with your patients. I would beg to challenge that. I think those are some of the hardest but most rewarding things that you can do, is be there for them. The final case and thing I want to tell you about is how we can change the course of our patients' lives. So not only medically, but their lives in general, in terms of education, what course they're on, especially ones that come from very underprivileged opportunities and situations. As I said, I worked with farm workers and their families, very, very poor communities. Some of these communities have had unemployment rates up to 35 or 40%. Health center patients overall, 75% of them meet the federal poverty level guidelines. And 96% fall within 200% of federal poverty. And over 2/3 of them are from ethnic minorities or underprivileged populations. So, this last case I want to discuss with you is about changing the course of their lives and their destiny. The first thing I want to start with is this is a House of Representatives Congressman Elijah Cummings, who spoke at our conference last year. And he still lives in a very poor part of Baltimore. And he's a congressman there and still lives in the same house he grew up in, but he understands what the challenges are for some of our populations. And so he's going to talk a little bit about changing that. So let me let you listen to him for a minute, and then we'll go on.
And you are the ones that go out there and change the trajectory of so many people's destinies. That's what you do. You change the trajectory of so many people's destinies. People who have no way to get medical care. Yes, we did the Affordable Care Act, but it was you who were doing the things that we've been trying to do in the Affordable Care Act 50 years ago. You've been doing it, and doing it effectively and efficiently. And so I've come by here to simply say thank you.
So one of our congressmen understands it so well, seeing from his community how people working in community health centers and working with underserved populations can really change their lives. And as he put it, the trajectory of their lives, the destiny, the pathway. So I want to spend a couple minutes telling you a little bit about Yehida, one of my patients whose destiny, I think, has been changed. So this is a picture of her nephew, Christian, and this is a delivery I did. In fact, this is my only and first second generation delivery I got to do. So over 20 years, it was really great. On my birthday, I actually got to deliver this baby, first, second generation. So the mother I delivered when she was 16. I guess maybe our family planning services were working. The mother waited till she was 19. So the mother 16, daughter 19. So anyway, I delivered this baby, my second generation one. But what I want to tell you unique about it is this family. So in this family, I delivered, I think, 3 out of 4 of the kids. But this family was a 3-generation farm worker family. Okay, so that's all they knew. For 3 generations, work in the field. Many of them never even went to high school. In fact, very few went to high school. And this girl, Yehida, was actually the first one to go to college. So one of my patients that I delivered, she was 18. She's now attending UC Santa Cruz as pre-med. So she wants to be a pediatrician. So why did this happen? This happened because of a lot of the things that you hear about and you see of how we can change the course of people's lives. She got some early input. She went to one of the preschool programs. They had what's called Migrant Head Start programs where they start educating the kids early on. She had great school counselors that really encouraged her to go on to help her to study. Her parents knew how important it was for education, so they told them over and over again, even though they didn't have one themselves, how important that was, stressed it. When she came into the health center, we would encourage her and always ask, and this is what I loved about the continuity of family practice over 20 years, is seeing these kids grow up. And I would have them come in and I would ask them when they were a little bit older, maybe towards 6th grade or 5th grade, what do you want to be when you grow up? And Yehida was the one that said, I want to be a doctor. And so through the years, we would continue to have those conversations over and over again. At the same time, her school counselors were encouraging her and saying, here's the classes you need to take to be pre-med. What are you thinking about college? How do you apply for scholarships? All those things they worked through with her. And so before we knew it, Yehida was ready to graduate. She had a full ride scholarship to UC Santa Cruz. So she's in her sophomore year now. I need to catch up. I haven't spoken with her for a while, but she's there on her course. So the point I want to make is that you never know as you take care of patients and you have contact with people and families, how you can actually change the course of their lives. This one will break 3 decades, 3 generations of farm workers. Nothing against farm worker families, we need them. But ones that are so stuck that they can't break out of that in terms of education and opportunity, you can help them break out of that. You can give them a vision. You can talk to these kids when they're 4th, 5th, 6th graders, give them a vision for their lives, help them along the way, encourage them, give them counseling, give them experience. We've had multiple students come in and shadow us to see what we do. Talk to them. Multiple of our physicians go to the high schools and junior highs to talk about healthcare and how you can make a difference in people's lives. So that's Yehida's story, and I hope that you all will take those opportunities and know that just by showing up and being there and taking care of people that are underserved and underprivileged, you can make a big difference in their lives. So those are my cases, but I wanted to make 2 last points that I think are very important. While you're doing all this, I think you need to, as I said earlier, keep your family or significant others very key in your life. I would hate for you to get to the end and say, you know, I worked really hard, I got my degree, I'm practicing, but then you've left behind relationships. You've let things go, you haven't developed them. So I want to encourage you to continue on that course and take time to maintain your relationship with your family, your significant others, friends that you meet here. You need to have a balanced life, and if you're blessed like I have been, you get that great combination of getting to do great work, having a balanced life, but also having some friendships that you develop with colleagues, with people you network with, people from the university, and ATSU. These are friendships and relationships that will go on for a long time. So I hope you can look back, and whether it's practicing in a small town in Missouri or an underserved population, I hope you can look back 20 years later and feel like you made an impact, that you made a difference, that you fulfilled your calling, that you can feel good about that and be rewarded. I think that is the biggest thing. And along the way, you're going to have some great experiences with your patients. You're going to continue to develop as a person, and your character will be deepened and broadened, and you'll be able to have more and more impact on these families. You'll have much more wisdom when you deal with things as you become more seasoned. But listen to your mentors. Grab people and take them aside and ask them, what was your experience with this? How was it starting out 20 years ago or 30 years ago or 40 years ago? Talk to your professors here, especially the ones that have practiced or have life experiences that they can share with you. Take that all in. And the other thing I want to encourage you on also is don't give up. I have a good friend, and we've been through a lot of major things together with family, loss, jobs, to really hang in there. We call it leaning into the wind. So whenever we call each other, see each other now, if there's a tough thing going on, we say, I'm leaning into the wind. And so what we mean by that is they've done some studies that if you have a tent and if you're up on a summit, you're backpacking or rock climbing or whatever, they did studies to figure out what the best direction to have your tent facing. So there's an opening to the tent, there's a little vent in the back. So they did studies to find out what the best way to put it. So you would think logically, you put the opening on the other side if the wind's coming this way, so you avoid it, They found out quickly that when you do that, the tent just gets blown off the hill because, it just hits you head on and there's no give or take or anything and it just blows off. So then they tried other things. They kind of turned it a little bit, so it kind of avoided it a little bit and kind of bypassed it. Same thing happened. It would end up catching it and pulling it off. So then they finally said, okay, let's try, the thing that doesn't seem so obvious. Let's put the opening directly into the stream and flow of the wind. And let's open the back a little bit so that a little bit can flow through. Well, they actually found that through physics, it actually kind of pushed the tent down and actually was the most stable position other than not having wind. And so what I learned from that is that many times in life, we try to go around, over, just endure hardship and tough times, but we really don't get that foundation and that strength of staying put and facing things head on. You got to have the right amount of letting things through so you don't take it so hard. You kind of have to let things flow through a little bit. But in the end, when you endure that, your foundation is so strong and you are very firm on what you're standing on and what you learn. So you will go on in your careers. You'll be able to face other things, and these will probably be with family relationships, loss, death, injury. Those things will come to your life, but when they come, you'll be able to handle it because you've taken that approach on life in every situation, whether it's school, whether it's rejection from something, whether it's a job. You will come out on the other end a stronger person, more focused, and able to endure these things because you need to be healthy to take care of your patients. So unless you're healthy and balanced, it's very hard to do that for your patients. So I just want to encourage you on that. I hope you all get to experience what I did. I feel so blessed, and really it was by God's grace that I got to do what I do. And a lot of it wasn't me. As I look back, it wasn't my sheer intelligence. You can look at my MCAT scores and my college scores. It wasn't sheer intelligence, but I think it was about focus. It was about endurance. And it was about keeping the right priorities in life. So, hope you enjoyed that.